everyone. Welcome to another exciting episode of Kopi Ruins. And yes, that was just a teaser. And this is exactly what I do at the backstage. I mean, it's so happy to be in our own home studio, which is just converted over the past 18 months. So thank you. Once again, welcome to Kopi Ruins. And today, our topic is all about cancer. Prevention is better than cure. As usual, before we start any of our talk shows, there must be always the signature cup of Kopi Events. And there we go. I hope everyone is having a fantastic day ahead today. Of course, the weather is pretty hot, so I'm sure everybody's hydrating as well. Okay, let's come back to the topic today. And today I have a very a great speaker with me. We don't know much of well known of both of us, but I think we connect very beautifully. We had a great conversation just before we going on live. And yes, he is our associate professor, which I will explain to you a little bit more later on that. But let me just going to cover this topic as well, right? The cancer. All right, it's a large group of a disease that can start in almost any organ or tissue of the body. Cancer happens when abnormal cells grow uncontrollably and invade nearby parts of the body. Spread to other organs. Cancer is also the second leading, can you imagine? Second leading cause of death globally, accounting for 1 in 6 deaths. In Singapore, the top 3 most common cancers in men are colon, rectum, and prostate, and lung as well. While the 3 most common cancers in women are breast, colon, rectum, and lung as well. Interestingly, the World Health Organization states that between 30 to 50% of cancer deaths can be prevented. Prevention also offers the most effective long-term strategy for control of cancer. So tonight, Kopi with Vance is privileged to have Associate Professor Ravindran to share with us more about cancer prevention. But and before every topic I start or bring my expertise on board, I usually do a little bit of research as well. But amazing, right? We have billions and billions of cells within our body, which are our cells. But somehow or other they turn against us. And they, all parts of the body cancer can happen any part of the body. And we also know that there are 3 types of therapies for cancer treatment, right? And with surgery, radiation, and chemotherapy as well. So without any further ado, I'm going to invite Dr. Ravindran on board. But I'm just going to do a little bit more intro before I get the honor of my guest speaker to be coming. All right. So our Associate Professor Ravindran Kanesvaran is a Deputy Head and a Senior Consultant of the Division of Medical Oncology on the National Cancer Center, Singapore. He's also an Associate Professor at the Duke-NUS Medical School and Clinical Senior Lecturer of the Yong Lin School of Medicine, National University of Singapore. His research interests include GU oncology and geriatric oncology, and has published a number of well-known peer journals, including Journal of Clinical Oncology and Lancet Oncology. He's the national representative and also the first Asia president-elect for the International Society of Geriatric Oncology. So let's invite Dr. Ravi. Prof. Hi there, Prof.
Hey, hi, Vance. How are you?
You looking? I am good, sir. How about you, sir?
Looking all good as well. I didn't know about the signature coffee cup. Otherwise, I would have brought my own as well. Next time, I should do that.
I will definitely pass one of that in very soon to you. Thank you, doctor, for coming on board. I know you might have a long day ahead today because I know all doctors are usually very busy. I've never seen any doctors who are just very relaxing and chilling, So how was your day, doctor, today?
Okay, all good. Waiting to be interviewed by you. Sorry, I lost audio a bit, Vance. I can't hear you.
Oh, sorry, Doc. So some of our viewers also from Indonesia have actually popped in, and I'm sure they're also getting some questions ready for us for later. So any Q&A we will be taking in the last 15 minutes of the time, and we will share with Prof to actually answer. So Prof, I'm going to ask you the first question itself. But before going on that, I know I've already done your intro, but can you just, in a nutshell, just say about yourself, Doc?
Okay, Ken. So basically, I'm a medical oncologist. So earlier you rightly mentioned, cancer therapy is divided into surgery, radiation, and chemotherapy. So a medical oncologist actually deals with the chemotherapy part. So we dispense medication, maybe hormonal, targeted, immunotherapy. There's so many different new classes of therapy, but basically we are the medical, we handle the medical part of it. The surgeons operate, and the radiation oncologists will deliver radiotherapy using, very nowadays they have a lot of state-of-the-art kind of machines that deliver radiation to kill cancer cells. So that's my specialty, but my special interest is in cancer in older adults, and that's what you read earlier about. You read it out, geriatric oncology. Basically, older patients, 65 and above, I have a special interest in treating them because they are unique. They have other medical problems. They are on many drugs which can interact with each other. So they need a lot more specialized attention than just younger adults with cancer.
Thank you, doctor. Thank you. I mean, before we even start our talk show, I actually lost my dad for cancer about 2 years back. So I do know the processes, the stages. When he was diagnosed for lung cancer, he was just basically having a cough, and he was a young boy, jumping around and all those stuff. But unfortunately, cancer doesn't send you invitation; it just comes to anyone. So rather a fit person or non-fit person, young or old, somehow rather, doc. I mean, before we even start with our questions, why is it the cancer just turned against us? I mean, why is it, there isn't any indications, right? I mean, when the indication comes in, probably it's
too
already
late.
a bit late. And of course, someone who does, checks on markers, cancer markers, then they identify, oh, I got an issue. But other than that, normal healthy people also can fall into that. Maybe we want to start the gear on that before we can go into our questions.
No, it's a good question. A lot of people ask why, isn't it? Why me? Why I've been healthy? I don't smoke, I don't drink, and there are other people who smoke and drink. Why they don't get cancer, right? So these are questions that always come up in people's minds. Now there are many reasons why people get cancer. About 15 to 10 to 15% are hereditary. So they may be genes that are deleterious. That means genes that are abnormal, that are passed down from generation to generation, and that can cause cancer, which means the majority actually happens during the course of a person's life from various causes. Later, I can share with you some slides going through some of these causes of cancer, which include habits that we have, like smoking, alcohol intake, the food that we eat, may be a cause as well. Of course, there's some myths and some things have actual scientific evidence that it causes it. So we need to differentiate, because always, on the internet and also on WhatsApp, we get forwarded a lot of messages, oh, this thing causes cancer, that thing causes cancer, avoid this, avoid that. I think at the end of the day, you need to go back to reliable sources. But definitely there are things in the environment that may trigger your cells to mutate. And these triggers, some of them are clear-cut, very well-known, like cigarette smoke. But then there are other things that are probably less well-known, including infections. And I think one of the things we can discuss later on would be infections that are preventable. That means vaccines that we can take that can prevent us from getting the infection. And by not getting the infection, we are preventing ourselves from getting cancer as well.
Thank you, Prof, for that. So let's get started on the first question itself. According to the local stats, 1 in every 4 to 5 Singaporeans may develop cancer in their lifetime, and the number of people living with cancer will increase. And we know that as we age, the risk of developing cancer increases. So cancer is the leading cause of death in Singapore. So can we prevent the cancer, or is it even possible to prevent cancer in older person? I mean, that's what your expertise is.
Yeah. No, it's a good question. So I think first thing I want to highlight is cancer is the number one cause of death in Singapore. So earlier you were discussing about mortality in the US, it's number 2. And actually now in most countries, developed countries, it's number 1. So in Singapore, it's number 1. 1 in 3 people in Singapore die from cancer. So it's much higher than heart attacks and infection and all that. And coming back to your question about whether it's preventable or not, the answer is in many circumstances, it probably is, because the cause of cancer can be things that you can prevent yourself from doing or consuming. For example, as I mentioned, smoking, alcohol, certain dietary habits. Obesity is linked with cancer as well. So not taking care of your health, lack of exercise, choosing the wrong kinds of food, all those things can make a difference. Now, the part about older people having a higher risk of getting cancer is true, because the older you are, the more risk you carry of having mutations to your cells that can cause normal cells to become cancerous. So that one increases with age. So that is true. But between two people who are aged 80 years old, there's always one person who may have a higher risk compared to the other person for various reasons. Maybe they harbor certain infections that increase risk of cancer, maybe their lifestyle, they are smokers versus non-smokers. I think one thing you hear me saying multiple times is cigarette smoke, is a major cause of multiple different types of cancers. There's so many different components of the cigarette smoke that actually causes cancer. So is it preventable? The answer is yes. But do we know all the causes? The answer is no. And we're still learning every day. So there will be circumstances where you have a healthy, fit person who still may get cancer, right? But the risk of getting cancer is lower if you maintain a good, healthy lifestyle versus someone who neglects exercise and things like that.
Thank you, doctor, for that. And we have one of our viewer, is Regina Stella Thomas. She said that I'm a cancer survivor as well. God bless you, Regina. Thank you for that particular message itself. So we have more messages that's coming in right now. So we have Kalanidhi has mentioned that number one, developed country wonder what's the relation there. It's not anything to do with the developed countries environment. But also, Doc, coming back to the question that we asked, I mean, we said that in the older person the cancer is higher in chances. Is that one of the reasons why the immune system, or because of their aging process? And maybe we will want to talk a bit of time on the mental state, but is it more because we start to learn about stress? So is it about managing lifestyle, trying not to go into that, not enough proper sleep, not hydrating, not into look at dietary nutrition, or even we always turn outwards, we always work longer hours than before, we don't have much of a rest, and it seems like, are we making ourselves as a victim for this? Is that could be the reason?
So you pointed out a few key points, and I think this links up well with the question that one of the viewers had asked just now about why developed countries it's number one, and if that's anything to do with the environment. Again, there are many reasons for this. One is healthcare systems in developed countries is better, which allows for people to grow older, live longer, and unfortunately, this links back to what you asked just now. When you grow older, Vance, what happens is your cells can take on more DNA damage or mutations over time, and that increases their risk of getting cancer. So a person who's 65 years and older has an 11 times higher risk of getting cancer than someone who's younger than 65. So having an aging population is one of the reasons why cancer becomes more prominent in terms of a cause of death in developed countries. So that is one reason. The other one about environment, you mentioned a few good points, which as of now we don't have a lot of research on, which I think it's important for us to know. How does work-life balance or stress increase the risk of cancer? Anecdotally, I mean, all of us see people who are under a lot of stress and duress, they end up with many kinds of illnesses, right? Heart attacks and all that. But cancer is also one of those things that may be increased with stress, but we don't have good research to prove that. Because how do you quantify stress? You do surveys, you ask people, are you stressed or not? But is there a physiologic measure? There are people who do studies, they look at steroid levels, and things like that, hormonal levels in your body, to try to quantify stress, but we can't. It's a feeling, right? It's a sensation. For a lot of people, they can't really. There's no way to quantify that. So that's why studies involving stress and cancer is really hard to do. But everything you mentioned, sleep, diet, all that definitely plays a role. I think large studies have shown, certain diets have an increased risk of causing cancer. Eating more red meat, eating fewer vegetables and fruits, things like that are not good.
Thank you, Prof, for that. Prof, I mean, prior to this, I did a little of a research. I mean, that's one of my interests in the medical and health, because I'm actually purely from the fitness and health. But it's very interesting. A study was done in the US, and I think they are practicing this. They are trying to integrate with therapies like acupuncture, neuropathic medicine, chiropractic, nutrition, dietary, and then blend them together for treatment plan for people with cancer.
Cancer.
Is there any positive signs that oncologists are seeing it at the moment?
Yeah, no, they are. And that's why they've incorporated some of these things. And if you go to leading cancer centers, the big ones would be Memorial Sloan Kettering in New York or Dana-Farber in Boston. They all have some form of integrative medicine incorporated into their cancer treatment programs. This includes exercise, diet. Acupuncture has been shown to be very good for pain control. So cancer patients who are suffering from pain, especially nerve-related pains, sometimes medications alone won't work. So you add on, all these complementary treatments that are effective as well. There are others that are still exploring things like TCM, Ayurveda. Yeah, but a lot of those medications have not been proven yet to be useful in treating the cancer, but may be used as an adjunct to complement the use of chemotherapy, radiation, and stuff like that. So I think that's something, even as a cancer center here in Singapore, we're hoping to explore. We're moving to a new building next year, so hopefully, we'll have more space to explore some of these, integrative therapies. But it's already in place in many centers. And exercise, even while on treatments like chemotherapy, has been proven to be effective in improving symptom control, giving you energy, and actually prolonging survival.
Doctor, just to add on that, I mean, as a holistic fitness that I'm doing right now, I do train few of cancer survivors, right? What I've actually noticed that the mental condition, the mental resilience has become stronger. I do tend to see there's a huge amount of positiveness that's coming in, right? The huge amount of positiveness that's coming in within them. I think it's like a whole package itself, right? I mean, you just have to make sure that you take your medicines, you try to do a recovery, and then you tend to take care of yourself. So I think it's a big process that we are all should be looking at. That's what we call prevention. Am I right to say that, Doctor?
Yeah, so you're right, because prevention means trying your best not to get cancer in the first place, right? So making all those lifestyle changes that are necessary in order for you to prevent that from happening. But prevention has one more facet to it, and we can discuss this a bit later as well, which is picking it up early in case you've already done everything you can, but in spite of that, you have a higher risk of getting cancer, either, high family history, high risk of, getting cancer because other members have it. Then you want to do screening tests as well. So there's certain screening tests that are useful, some are not. And sometimes everything gets jumbled up together in all that exact screening that people go for, blood tests and all. And yeah, we can discuss that as well. Because when you do screening, you are actually trying to pick it up at the earliest stages so you can actually still achieve cure. But ideally, of course, if you can prevent it, that'll be the goal.
Doctor, I think we are not sure. I mean, I'm not sure when was cancer was such a deadly disease was ever found. But until then, so much of research has been done, so much of trials has been going on. Medical science is always trying to do a breakthrough of this. But this seems to be do we see a light at the end of the tunnel? I mean, in the years to come. I mean, we have improved.
Yeah.
Medical therapies has improved. So many things has improved. But do you think will there be ever a cure for this deadly disease in the future?
That's the golden question that, I don't think anybody can have a clear answer at this point in time. I think what has definitely happened is medical science has brought us, to regions we have not, thought it's possible. So firstly, I give you an example: lung cancer. Maybe 20 years ago, we just had some basic chemotherapy, and when you had cancer and stage 4 lung cancer, and I presume your dad may have had that as well, the survival was somewhere between 6 months to a year, even with chemotherapy and all that. Now we've discovered that even amongst patients with stage 4 lung cancer, there are various subtypes. We call them molecular subtypes. It means they carry specific mutations, and the latest therapies are targeted. They hit those particular mutations and actually can shrink a lot of those tumors very well. Some even achieving some level of short-term cure. And we're looking at average survivals for those kind of patients hitting 4 to 5 years now. So it's nearly 5 times what they used to, experience in the past. So bottom line is, science has brought us, brought a lot of advances to patients who suffer from this in the late stages, but they still eventually will succumb to the disease, unfortunately. So that's why we still need to do more. There's still a lot of active research in this area. But to answer your question, cure, not there yet. And we always hope we'll reach there someday, and I believe we will. But when, that's a question.
There's a golden question to be answered eventually.
Yeah.
Thank you, Prof. We'll be going into the part where we always want to talk about sleep, diet, physical activity, and cancer risk.
Yeah. Do you want me to share some slides? I can.
Yes, Doc. Please.
Go through.
I know you have some slides for. Yes, please.
Yeah, just a brief thing. This is one of the common I guess talks that that we give to general public as well for information. So I hope it's. Can you see my screen?
Yes, Doc, I do.
Okay, so very briefly, it's a few slides. Okay, this is the National Cancer Center. I mean, we do a lot of research as well, and so this is one book I would recommend for people who want to know the history of cancer. So it's a biography of cancer. It tells you when the earliest reports of cancer, how cancer has progressed. When chemotherapy first came in, how it managed to cure children with cancer, and that's an area where cancer has really progressed, where children even with late stage cancers can be cured, blood cancers can be cured. So this is by Siddhartha Mukherjee. He's an oncologist based in New York, and it was a New York Times bestseller. So I think that's something to think about. This is briefly about cancer. I mean, we know there are many types, and majority happens in older patients with cancer. So what causes them? There's chemicals, there's viruses, bacteria, radiation, and some things that are internal as well, things we consume, our diet. And like I mentioned, about 1 in 10 or to 1 in 15 patients, 15% of patients actually get it via, inheriting genes from their parents. So I told you environmental factors, and I always mention tobacco because that's something you can really control. Obesity you can control. Infections to some extent you can. There are vaccinations as well for HPV that prevents you from getting cervical cancer, for example. So modifiable causes, these are things that you can do to reduce your risk of getting cancer, right? So now focus on diet, because that's something you mentioned earlier in your question as well. And it accounts for a significant proportion of cancers in adults. Now, there are many things about diet, right? So there's dietary fat. So what is the evidence behind all these things? And I'll quickly go through with you. So dietary fat, there is some link to certain cancers, like prostate cancer. Red meat also linked to colorectal cancer. Fruits and vegetables are good. So it reduces your risk of certain cancers, including prostate and colon cancer. Dairy, not really associated. A lot of people say, don't take dairy when you have cancer and all that. It's not true. You should still take if you need it. Fiber definitely reduces the risk of colorectal cancer. Sugar or glycemic load, I think overall there's an increased risk, but it doesn't mean you should totally cut off all sugar if you already have cancer. I think it's not proven to worsen your cancer progression. And the last bit is vitamins and macronutrients. I think this is something we can talk about in a short while, when we talk about antioxidants like vitamin A, C, and E. Unfortunately, it's not been found to be beneficial in reducing the risk of cancer. So that's an area that was quite surprising, because you read a lot of things in all these, magazines that promote supplements and all that about how antioxidants are really good. Unfortunately, that's not the case in large trials. In fact, some antioxidants like vitamin E in prostate cancer, selenium in a particular trial was found to actually not just not benefit the patient, but may in fact increase risk of certain types of cancer as well. Same goes with beta carotene in high doses. So certain vitamins are actually bad and can actually increase the risk of cancer. So maybe I'll stop sharing here and go back to your questions. Yeah.
Okay, doctor. So, I mean, we talk about sleep, right? I mean, we all know what will happen if someone who doesn't have a proper 8 hours or 9 hours sleep. Nowadays, people are just sleeping 2 hours, 3 hours, and then so many other things are actually. I think we live in a world that constantly we are just chasing after
On the
the
books.
dollar sign. Uh, but as we chase after the dollar sign is actually running faster than us. So people have to work extra harder. So sleep is, I think it can lead to a lot of other issues, because the human system, I think, is constantly working without any break. So if we are not giving good significant amount of rest, I think it is also lead to a lot of stuff. But of course, there's no evidence showing that sleep also can cause cancer. But what is your take in this, doctor? I mean, we talked about this earlier on. You covered nicely on the diet part, but sleep and physical activity. I mean, a guy or woman who's very fit and strong, who goes to the gym, who does activity, who eats clean, and I do know a marathon runner who's a very fit guy. He got a lung cancer. So what is this equation? Because there's no equation. So oncologists like yourself and Prof, you will have, you'll be also confused. What is exactly is happening? Why a super extreme athlete also can be a victim for a cancer? So where we are heading to?
So I think that's unfortunately, what I mentioned earlier, the reality of the matter, which is you can't predict who is going to get this, except those who don't get enough sleep, those who don't do enough physical activity, or choose their dietary choices are poor, have a higher risk. But it doesn't mean if you don't do those things rightly, or you do it rightly, you won't get cancer. Because like the gentleman you mentioned, he's an athlete and all that, runs marathons, but of course on the side you wonder, does he have any of these other habits? That's one question. Number two, could it be familial? Is it something that he got from other, the fact that other family members also have cancer risk, and he carries a particular gene that increases that risk? Could it be environment, because he's jogging, in on the roads? There's fumes. There's every once in a while we suffer from haze. We don't even know the impact of that on lung cancer rates. I mean, in Singapore, generally smoking people who smoke are fewer in number over the years for many reasons. Government campaigns, taxes on tobacco, but people now we are getting a lot of non-smokers who are getting cancer. So it could be something in the environment as well that we have not really identified at this point in time. It could be all the haze episodes that come every July. It's in many years in the past. So that's why I think it's wrong to think of it from an angle that if a person sleeps enough, and that's important, it does help prevent obesity, and obesity is linked to cancer in many studies. Eating right, exercising enough, and you still get cancer. There are many other reasons that are out there that we can't explain at this point in time. But the key thing is, if you do it right, your risk of cancer is a lot less, right?
Thank you, Prof, for that. We are also going to the next one. I know you have covered this. We talked about antioxidant, and this is widely open in the market, where people are constantly taking a lot of vitamins and antioxidants, and I know that people are very health conscious nowadays. I know you have answered that, but is there It does help. It does help. But what is to a certain level? What are we looking at? Even though we live in a tropical country, we are still vitamin D deficiency, right? We
Yeah.
don't have enough of all these vitamins and kind of stuff. So, what is your take on this, though?
So I think antioxidants, firstly, theoretically, it makes sense because one of the potential causes of cancer is the development of free radicals in your body, right? So every time you consume food and the food is used to provide you energy, one of the byproducts are free radicals. So free radicals circulate, right? And the thinking is free radicals can actually destroy good cells and they cause DNA damage, and that may lead to cancer. So this is, of course, partially proven as well in the lab. So the thinking is if you have something that can mop up all these free radicals, and these are antioxidants. So this includes the ACE vitamins, A, C, E, flavonoids, and all these are present in our natural food, vegetables, fruits, rich sources of all these antioxidants. So when we look at studies that are well designed, these are phase 3 or what they call randomized controlled studies that looked at these antioxidants. Unfortunately, currently there's no data that shows that consuming them in levels that are higher than what's available in your natural food actually helps. And in fact, too much of it may actually make it pro-oxidant, too much of it. So what I would recommend is, firstly, if you have a well-balanced diet, and HPB always has this their programs, how much to put, how many portions of vegetables, fruits you need in your meals. So if you follow that, you don't really need to top up a lot of these things. Now, vitamin D is a different question altogether. And you're right, many people are deficient in vitamin D because although we live in a tropical country, every time people go out in the hot sun, you see them holding umbrellas, everyone runs back to their homes, switch on their aircon. It's too hot out there other than exercise. And when they exercise, everything is like covered up with UV protection, gear, whether it's in the pool and everywhere else. So, people don't get enough vitamin D by natural sunlight. And if you don't get enough vitamin D, you can't absorb calcium, and then leads to many problems, osteoporosis and all that. Is there a link to cancer? Again, preclinical studies do show that there may be some link, but actually none of the large studies have shown any link for deficiencies in these vitamins. So bottom line is, if you're taking a lot of vegetables, fruits, get some sunlight, should be fine from many viewpoints, and you don't need to add on many of these supplements to prevent getting cancer because none of the studies have shown that.
Thank you, Prof. Thank you for that antioxidant and also the sun that we needed. Even nowadays, if you look at it, the place that I do go to a couple of gyms, and it's all with aircon, so it cools you down. I mean, basically we understand because of the ventilation, it can be a bit odor and kind of stuff. But sometimes it's good that you go out and do a run and then you get yourself perspired. So I think that's the way you're opening up your pores, your perspiration is going out. I mean, it's just a form of thermogenic and your heat production from your body when you exercise. So I think that part I totally agree as well. We need to go out in the sun, so we should be leaving our umbrellas at home only for rain. Then we should carry. Doc, we're going to go to the next question. From your experience, what are the some antioxidant people can take in on a daily basis to prevent cancer?
So actually, this leads on from the last question, right? You don't need any additional antioxidants to be taken on a daily basis because it's not been proven to prevent cancer. And if you take it in levels or that are too high, it actually can be bad for you. So rather than focusing on antioxidants and supplements, you should focus on a healthier, balanced diet. That's more important than considering adding on vitamins that are not so useful.
Okay, Prof. We are taking one question right now. So you mentioned about alcohol earlier. So how does alcohol affects, and is it bad to have occasional to be a drinker? So I'm sure This will be a lot of people's question in their mind.
Yeah.
If I should avoid alcohol.
Yeah. So I mean, everything in moderation is fine, and that's why there's recommendations on how much alcohol you should drink, because alcohol can cause so many different kinds of problems, right? One, liver problems and chronic liver damage in the long run, many years down the road, you get fatty liver and you can get liver failure and also liver cancer. So that's one way it can affect you. Chronic alcoholism also can cause damage to your GI tract, and you can get any of the GI, gastrointestinal cancers as well. Now, to answer your question, is it bad for occasional drinkers? It depends on whether you drink small quantities occasionally or you binge drink occasionally. There are two different things. Binge drinking also is not good. Still causes significant damage to your organs. So if you drink moderately and once in a while, it's not going to do much harm. So I don't think that's big problem. Yeah. But what I mean by alcohol is chronic alcoholism, drinking a lot regularly, and that's going to cause damage to your organs and potentially increase your risk of cancer.
Thank you, Prof. We have Regina here. So thank you, Regina. I mean, she's a positive about the treatment. I trusted the doctors and believe the treatment. So she's sending messages here. Thank you, Regina, for that. Wish you all the best and also God bless. Thank you, Prof.
Once I lost your audio again. Sorry.
Sorry, doc. Sorry. So does genetically modified food also causes cancer?
Okay, this is again a major controversial topic, but I think the good news is in Asia we don't really consume that much of or produce and even consume a lot of genetically modified food. A lot of it is produced in North America, US, Canada, Europe. Also, they're very selective about the kinds of genetically modified food. Why do people even have these kind of food, right? I think that's the first question. The answer is because it's a more efficient way of producing food. This kind of genetically modified crops, whether it's corn or other kinds of wheat and so on, they are all modified to an extent where they are resistant to being attacked by whatever kind of pests that exist in these farms. And because of that, you don't need to use pesticides. So there's some benefits as well. I mean, you don't have pesticides and all on all these crops. Now, and you get to produce them in larger scale, in larger quantities, more efficiently than normal crops. People's concerns are when you make changes to the genes and people consume this, will it affect them in the long run? And the Food and Drug Administration in the US have looked at it in great detail because they have a lot of GMO products in the US. And they found that it's not unsafe. It doesn't cause cancer. But there's still a lot of doubts. So that's why many countries don't actually allow these kind of products to be sold. And interestingly, even places like Kenya, they don't even do GMO stuff in their crops, even though it's quite challenging in terms of agriculture in those countries. But so the answer is we don't have enough evidence to show that it causes cancer, but there's still doubts, and I think scientists are still doing studies to see whether this is true in the long term. But as of now, the answer is no. It's safe. FDA approves it, and a lot of these products are sold globally.
Thank you, Doc. I mean, along the same, still in the food part, we always talk about the processed food. Those food like, you buy it so cheap, extremely cheap in packets, in frozen, where you can just barbecue it. Are we adding more problems to ourselves instead of, solving these problems within ourselves? Instead, we are adding more problems because one is cheap, another one is good, another one is easily prepared and it's tasty. On top of that, it tastes really good because I think all these artificial things are added into it, the pepper, the salt, whatever is inside. You can't see what meat is that, but what is this could be also be a problem in the future, or is it already a problem right now?
I think it is a problem in terms of obesity and general well-being and health, right? You rightly mentioned a lot of these are high salt content products, and they have things like preservatives that keep it, in such a way that you can just, freeze it in your fridge for a while or put it in normal fridge temperature and still, take it out and heat it up and eat, because all these preservatives are keeping it, still viable. Now, all these things generally not good for you. I mean, lots of salt is not good. Sugar, a lot of these things have all these products that are not healthy for general well-being. Does it cause cancer? Yeah, we don't know. We don't know. Now, but because it leads to obesity, and then obesity can, increase your risk of certain cancers, the answer is yes. So indirectly, yes. Directly, we don't know whether these things will cause cancer.
Thank you, Prof. I mean, we are already having a biggest major pandemic with us, which is obesity, diabetes. On top of that, this COVID-19 also add on to the problem, not a solution. But it seems like, when someone who doesn't control food or doesn't exercise, someone who's constantly working, not enough rest, binge eating, eating all those food that should not be eating, fast and quick. So once the obesity comes in, diabetes kicks up. And then when diabetes kicks up, your blood pressure comes in. And then your blood pressure goes up, your cholesterol is there, and then you're leading more problem for your myocardial infarction. So it seems like, if we can prevent this earlier, but the choice, I think, is it something to do with the mental condition that, we all live in this fast world that we need everything fast? I mean, is this could be the reason that the cancers are in the higher range, because we're not sure what it was back in 60s or 80s, is 60 years ago or 30 years ago, 40 years ago. But nowadays, the stats, it's a bit scary, right? 3 in 1, 4 in 1. It seems like, hey, everybody just want to hope, hey, it's not me, it's not me. If it happens, that's it, the Lord is calling you back. It's very crazy to go through, not only emotionally drained for the family, but the person who's having the condition. I do not know how, I can't explain how the person will go through, nightmares and kind of stuff. But based on the observation from my dad, I know he went through hell, he crawled out of it, and he tried to go. It's a big major turbulence for the whole entire family, going through this. In your line, doc, I mean, you have seen people, and then you don't see the people in the next 3 months or 2 months. How do you feel, doctor? I mean, you see cases like just, I mean, Prof, how do you make your heart to be the strongest iron or whatever you call it to be? It's tough.
Yeah, no, I agree. It's tough. Like you rightly mentioned, it's not just the individual, right? It's the family members, the people who care for them, the friends. Everyone gets, affected when someone has cancer, and seeing them, go through every single stage, and especially when it's terminal, the last few stages, I think people get, really drained, right? So we did a study on this a couple of years back on caregivers of cancer patients, like how you were or your family was, your mom and everyone else taking care of your dad. And what we found is many of them suffered from caregiver stress, and because the focus is always on the patient, and the caregivers, unfortunately, are neglected, because who's going to take care of the caregiver? Who looks after their welfare, right? And so it's multifaceted. Many people get affected, and for us, delivering the care also, it's not easy. Seeing patients eventually suffering so much, and we're trying our best to alleviate their suffering. By the end, they still pass on, and we have to learn to move on and try to help someone else go through the process as well. And sometimes knowing that the end is coming, I think the key thing is focusing on quality of life, right? Making them as comfortable as possible. And most patients, that's the main thing they want. They'll tell me, doc, it's not how long you can make me live, but for that period that I'm going to live, can you make me comfortable? Can you make sure I don't suffer pain? I don't suffer, all the side effects, nausea, vomiting, or at least minimize that. Yeah. So that's the key thing that we hope to be able to, deliver to our patients. Going back to the first part of your question about our lifestyle, I think, sometimes, people have feel they don't have a choice, right? They have to work to put food on the table. And in the process, all these things get neglected. But now I see a change, and I think you see it as well. People will approach you and say, Vance, can you be my, fitness coach and life coach and things like that. Because they see what you offer as something holistic, you see, that can sort out a lot of their, issues, whether it's physical, mental, so on and so forth. So a lot of people are seeking this out. Many people have turned to yoga. A lot of people are running nowadays. Circuit breaker. I've never seen so many people run ever, right? So one is to get out of the house, but I think a lot of them, it became a habit. So it's a good habit, and so we are seeing a change. People are getting aware, and through these kind of platforms, they get all the information, and hopefully more people will make those right changes.
Thank you, Prof. We will want to take a question right now. And I think Regina also been a greater support here. Thank you, Regina, for all these messages they're sending. I mean, I'm sure you have went through the biggest hurdle and overcome all these challenges and obstacles that you have. Thank you, Regina, for all the messages that's coming in. I was alone in my journey. Yeah, could be challenging as well, but you are a survivor. Thank you, Regina. Doc, so we have a question right now here. Dear Prof, what is the advancement of breast care treatment in Singapore? For an example, triple negative or 2+ question mark, if I get it right, yeah?
Yeah. So, okay, firstly, disclaimer is I don't really treat breast cancer. I'm a urology oncologist, so I treat prostate, bladder, kidney. But I can answer this. Firstly, I think one of the reasons why the viewers asked about triple negative is it's a very challenging cancer to treat amongst breast cancers. It's in fact, one of the most aggressive breast cancer types that we know of. And the latest will be recently they found that immunotherapy with chemo given before surgery is done has been very effective. So new immunotherapy has come in a big way, even in breast cancer. So that's a new innovation that's come in the last maybe 6 years. But in breast cancer, just over the last, I think 6 months ago, it was approved for use in triple negative breast cancer. So that has improved survival for that group of patients. So immuno plus chemo before doing surgery has been one of the major breakthroughs.
Thank you, Prof. Thank you, Premi. Thank you so much. We have another viewer who's constantly asking in Bahasa Melayu. William, I truly understand. I know all the messages are coming in, but it will be appreciated if you can type it out in English so that I can ask Prof as well, because there's a couple of messages that came in. So it's not that I don't want to answer these questions or Prof don't want to answer, but we try to keep it very in the English format. Yeah. Thank you so much. I hope you understand that. Doc, we are going to go to another few more questions before we call it off a day. To date, is there a vaccine that can prevent cancer?
Yeah, so good question, and the answer is yes. So, as of last year in Singapore schools, anybody who turns, all females who turn 12 are given an option to get the HPV vaccination or human papilloma virus vaccination. Why? Because HPV is a proven cause of cervical cancer, which is amongst the top 5 female cancers. So once you get the vaccination, your risk of getting HPV reduces significantly, and your risk of getting cervical cancer obviously drops to negligible levels. So that is the only vaccination so far that's been shown to prevent cancer. Now, are there other vaccines coming into the picture? The answer is yes. Some are used to treat cancers. So that's in fact, the mRNA vaccine that we all got for COVID-19, all those companies that developed it, BioNTech, Moderna, they were all cancer companies. The mRNA technology was actually meant for cancer, to find treatment for cancer. But they obviously used the same technology to develop vaccines for COVID-19 as well. So vaccines are going to come in a big way, but for now, yes, there's the vaccines that we use to prevent cervical cancer that all females will get once they are 12 years old.
Thank you, Prof. Prof, we also have Premi again. Also, she's asking some advisors here. Can breast
Yep.
cancer patients who has completed treatment can take HPV vaccine?
Yeah, you can. The thing is, HPV vaccine works best when you have not been exposed or you've not had sexual intercourse or exposed to the virus. But if you've already been exposed to the virus, then the benefit actually reduces tremendously. So it doesn't mean you shouldn't get it, but you should talk to your doctor about it and then consider doing it. But as I mentioned, it's best taken. In fact, if you look at the labeling, also initially the studies were all done on patients who were people who are less than 26 years of age.
Thank you, Doctor. Thank you, Doctor. We just have 5 more minutes. So if viewers have any more questions for Prof, please do so, because after which we're just going to end the session. Prof, just it's my question personally. When you just finish your medical school and kind of stuff, is there something that interests you to become oncologist in this part, or is this something that that inspired you, to go deeper into this?
Yeah, interesting question. And actually, like you, once I lost my mother to breast cancer, and when she first was diagnosed, which was in 2007, was when I was deciding what specialty to do. And when I went, reading about, breast cancer treatment and all, I realized there's just so much that to do. There's so much to do in oncology because we're so far away from a cure. There are not many treatment options, and that got me interested. At that point, she had localized cancer, which was cured. Unfortunately, it relapsed in 2015, and she passed away 2 years later. But by the time I was already an oncologist already. But that was one of the reasons why I got into it.
Thank you, Doctor. We really hope that in the medical science there's some kind of a breakthrough, because even though I remember this many years back, I was training a gentleman. He was 38 years old and he was still studying in the NUS, and he's actually in one of the cancer research team. And I told him, will you ever stop studying? He said no, he's been studying for the past 38 years and he's still studying and he's still working on this, a new, hopefully a miracle that that is hoping for. But it's such a in most of these diseases, even we talk about HIV, after quickly, as soon as possible, they found medications and to prevent it and kind of stuff. But these seems to be very, very challenging, right? Our own cells are turning against us for no reasons. It's a bit of a challenging to even to talk about it. And you have been in this for many years, and I'm sure you also been looking at all these things. But again, Doctor, we're coming back to the same old question that we talked about. And in the near future, you think more uh, areas of solutions can be found? Now when we compare, now is so much better, right? In terms of hospice cares and even
Yeah.
therapies that we all talk about. But do you think it will even get better as time goes by, and
Yeah.
eventually things will get better?
Yeah, for sure. I think what you mentioned is obviously once cancer is terminal, at the tail end. But I think the big focus now should actually be in preventing it, right? Lifestyle changes, go and exercise, get enough sleep, diet, those things that you mentioned many times in our conversation. And you're going to see, you're already seeing people doing it already. You're seeing people, now working from home, they realize that, I can carve out time for exercise. I can do a lot more of these things. Of course, there's a school of thought that working from home has caused more stress and more work because your boss can reach you at any time and ask you to do things. But I definitely am hopeful that things will get better. And now with technology, that we're going to probably reach a stage where you could do a blood test, and that blood test can screen for actual, DNA components of tumor cells circulating and pick it up at a very early stage before even the cancer develops in a person. And one area where this has advanced is in nasal cancer, nasopharyngeal carcinoma. And so this kind of tests are going to come in a big way. So this is bringing forward the diagnosis even before it forms, at a super early stage, and find treatments at that point before a patient gets it. So prevention still better than cure, right? If you don't get it, better than getting it and trying to find a cure for it. And cure is still better than finding it out very late, where it is, palliative and things like that. So I definitely see a shift to the focus on prevention and more treatments that can cure.
Thank you,
All right.
doctor. So what will be the suggestion? I mean, for everyone to go for a test in for cancers like a markers, to make sure that one is safe. Is it like a yearly thing that they have to go to for early prevention? Even for women, the breast, or even for the guys, the prostate. Is there a indication like every 8 months or every after a certain age, maybe say after 45, you need to do it every 6 months? Is there some kind of
Yeah.
guideline?
For some cancers, yes. For a lot of cancers, we don't have that kind of screening guidelines. So, for example, you mentioned breast, right? So the current guideline in Singapore and also many countries like the US is once you're 50 years old, you should be doing your mammograms once every 2 years. But if you have strong family history, like someone else who has breast cancer at a younger age, then you may have to consider doing it from 40 years onwards. So it depends on these things. These things are available online. You can actually check them out. Singapore has cancer screening guidelines. It's a bit dated, about 10 years old, but nothing has changed in terms of the science behind it. Prostate, for example, also can start at 50, but you need to talk to your doctor whether you want to do it or not, because a lot of times, sometimes doing these tests may yield false positive, cause a lot of anxiety. That's why I wouldn't recommend just doing blood tests that look at tumor markers. You mentioned just now, some people do tumor markers and they find out. Actually, a lot of people find out the other way around. They get a positive tumor marker test and actually don't have anything. And in the process, they unnecessarily go through colonoscopes and CT scans and all that. So I think, talk to your doctor, and your GP will be able to advise on what's got evidence behind it and what doesn't. Yeah.
Thank you, Prof. So we just take one more last question and then we will end the session itself. So you said that I know a patient, doctor. It's about cancer stage 4. I believe that it's just can live for 4 years. Heard about prostate cancer stage 4 can live for 10 years. So I think William is just asking about the number of years if someone is already in the stage 4 for the life, either is for 10 years or 4 years.
Yeah. So I think this is, again, is a clear example of how different cancer is from patient to patient. So I think what he means by what he heard about stage 4 cancer patients can survive 10 years is one end of the spectrum. Patients who have very slow growing prostate cancer, maybe only affecting some lymph nodes, and the prostate can be treated with radiotherapy, things like that. With current treatment, we can push maybe 7 years and beyond, up to 10. But there are others whose cancer spread is very extensive and looks like, I think this patient, has all the treatments that we can offer in that list. And unfortunately now is only at the 4-year mark. So there are, different ends of the spectrum. So it's not about whether this patient got the right treatment or not. Looks like everything, that is out there has been given to this patient. It's just he's got a more aggressive disease. That's unfortunately the case.
Thank you, Prof, for spending almost 1 hour of your precious time. I mean, this 1 hour of your time, you probably will have spent more time with your family or taken a well rest before you're heading to, but I'm really privileged to speak to you, Prof, on the topic of cancer, and I'll bring a little light to the end of the tunnel, and also to our viewers as well in Kopi with Wen. So, thank you so much, Doc. Is there any final tip or advice that you want to say to our viewers who are watching this?
Nope. I think most of things we discuss about lifestyle, right? Diet, exercise, sleep. screening tests, vaccination. So I think you covered everything once. It was great talking to you as well, and thank you for the invitation.
Thank you, Prof. We will definitely stay connected. I'm sure there will be more talk sessions in the future and a lot more other exciting stuff to do with you as well. Thank you, Prof. We will stay connected. And thank you so much.
Thanks, and good night, Mats. Thanks.
Thank you, Prof. All right, so that was the our associate professor Ravindran Kanesvaran. Thank you so much for spending almost about an hour. I mean, to have his time at Kopi Events is really blessed. I'm really blessed to have him on our talk show. That's what Kopi Events is all aimed about, to bring individual experts in the medical field to come and give their expertise on these areas, and of course for viewers as well to sit back at home and enjoy you know our health shows. And yes, we have more exciting talk shows that's going to come up, lined up as well for next month. And if you do have any topics that you want to know or you want us to bring in, so please, as usual, message us at Kopi Events, and I'll be most delightfully, look into this and see how we can bring this topic. But just talking a little bit on what Prof have said, I think it doesn't matter who you are, either you are rich or poor, or whether you're staying in the middle class, or you're staying in the biggest bungalow, or you drive a sports car, a non-sports car. You can be fit, unfit. These are things that are real thing about life. Your own body will turn against you, and I think this beautiful, we call it the body, but some call it the beautiful machine. If you do not take care of it, it will definitely will break down. And I think time to time we need to do some reality check on ourselves, make sure that we eat well, as what Prof has said. We need to sleep well, need to hydrate well. We need to take our minerals and vitamins. And at the same time, we need to slow down. Certain times, slowing down is perfectly fine. I think the problem is we don't slow down. That's what I think the human is designed for, right? We always rushing out for things to get it done. We're always working on a deadlines. We are always on stress. I think we need to take a few steps back. I think it's not a big issue. At the end of the day, of course, we need to do what we need to do. But if you tend to relax yourself a little bit, I think a lot of stuff that over the past 18 months in Kopi events we talked about, mental resilience, how you fine tune it, or even when we talk about nutrition, when we talk about a lot of other stuffs of the body organs, we covered a big variety. I mean, for me, I'm learning as each topic goes by. It's getting into deeper and deeper. um so yes, so we're going to bring in more experts on board, like just like Prof. Thank you, Prof, for joining us at Copy Events. It's my great pleasure. And I will catch you again on our next topic, which we will release the topic very soon. For now, this is Vance, Copy with Vance. I will catch you. Ciao.